So we're doing this real quick because I had some people ask me about, Obamacare and the Medicaid and stuff like that. So you guys know the Medicaid is an assisted program, and Obamacare, it's almost an insurance program, depending on which one they put you with, what Advantage Care, that they put you with, or what managed care. Obamacare is not cheap. Okay, so some of you who may have Medicaid as a secondary or may have Medicaid as a primary, um, and you feel like they're going to take it away or you're not going to do the workforce that they're telling you to do and you want to get your own insurance, the next step that you can do is to try for the Obamacare. Uh, Obamacare is not free. Obamacare is a lot of money. Now, I don't know why they make people think or feel like Obamacare is cheap. It is an alternative, and most people who have their own job, have their own business, they do have the Obamacare. But I can't hear myself. But Obamacare, it costs a lot of money. I mean, I've seen Obamacare cost as much as $335 a month. And then you have all these initial fees that has to go with the Obamacare. But to me, if you want to be safe and not getting a lot of bills, I think, the Obamacare may assist you if you're going to a hospital and you don't have insurance. I think I probably would rather have the Obamacare than no insurance at all, because they're going to bill you. When you go to a hospital, you're going to come in as a self-pay patient. Um, there is no sliding scales in regards to the fees that they're going to charge you, because when you have a managed care insurance, they, let's say their fee is set rate $1,000. The facility or the hospitals can't change it if they are in network with that insurance company. If they are not, they can pretty much charge what they want. But when it's a patient and it's self-pay, they can charge sky's the limit. Um, Now, I heard the thing about they can't put, like medical bills in your credit report or something like that, but you still owe them. So, I would definitely think about it long and hard. This thing that's going on with the Medicaid, your only alternative, there may be more of an alternative, but the Obamacare, it's expensive. A lot of people don't know that Obamacare costs a lot of money, and it will pay for your services. I mean, you're still going to have a copay, you're still going to have a deductible, and I've seen deductibles as high as $9,000 for Obamacare. And again, it depends on what state you're in. Your copay or your deductible may be, flexible, and it's just like having almost commercial insurance. And but then you have providers that don't take Obamacare, so just be careful. So if you're losing your Medicaid and you've got to get insurance, and you think that you're going to go for Obamacare, nothing's wrong with Obamacare. But it's going to be expensive. It's going to be expensive. A friend of mine, he drives a truck, and he asked me to help him, with the Obamacare, and it's a lot of money. I mean, he's gone to the dentist, XYZ, but he said he paid almost $200 to go to the dentist, and his deductible was low. It was only like $5,000 or something like that. Well, I know that's a lot. But he went, and he still had to pay. I mean, you still have to pay off some of that deductible. If you're working somewhere and they offer insurance, I would go ahead and opt into that insurance, because I know a lot of people who have the Medicaid as a secondary insurance. It's an assisted program, so you guys hear me say insurance, you know what I mean. But to have insurance and to go to a doctor and you just feel safe, I would rather you just have insurance. I have been looking around to see if people have different types of insurance other than commercial insurance, Medicaid or Medicare. Let's see what else is out there. And the only thing that I've been able to come up with is the Obamacare. And if you guys come up with something else, let me know if you come up with something else in regards to what type of insurance that you're going to get that will pay for some of the services that you have. If you guys have long-term illnesses or diabetes or something like that, Let me know what you feel about the Medicaid. Everybody who, I guess they think everybody who stays at home or some of the single parents or whatever, everybody got Medicaid. Working people have Medicaid too. hmm Working people have Medicaid too. If you guys look up Medicaid, it's a cap, just like there's a cap for Section 8. If you make this amount of money, you can get X, Y, Z. If you don't make 60, $70,000, you still entitled to Medicaid. I mean, you somebody might be making $30,000 already, and then they have the Medicaid. You know what I'm saying? I mean, how much of the services are they going to cut off? I don't know. I'm looking for people to tell me what type of services do they have. How do they feel about the cuts on the Medicaid? I'm trying to watch the news to see when will these cuts actually go into effect. I heard somebody say something about 2026. These cuts will go in effect. I'm not sure, but again, you have different states that have contracts with the states for the Medicaid, and then you have the federal side. I'm thinking that it's just the federal side, but I've heard, some of the states are saying they're going to hold back money that they're paying to the federal government because of the cutbacks. So, to me, like I said, just kind of be precarious when you guys are going to look for other insurances. And because you still gonna have to pay for it. You still gonna have to pay for it. Do I agree or don't agree? I don't agree with it now because I don't agree with it because it's something that should have been done a long time ago. I mean, you're taking parents out of the house and you're making them work for their insurance for their children when they've been home with their children 4 or 5 years. Somebody's got to watch those kids. Who's going to watch those kids while they go out and work for the Medicaid? It's kind of hard. So I think they got to compromise with something, for these people when they are taking away these different things. I mean, the babysitter and all this other stuff was already taken away, but it's going to be kind of hard, even for those people that are saying, some saying, we'll get Obamacare, we don't X, Y, Z. But how you going to pay the Obamacare? You have to work to pay for the Obamacare. It's not cheap. I'm telling you right now, Obamacare is almost $400. Um, they have one. I don't know. It's called Trauma Care or something like that. It didn't make any sense. It didn't even make any sense to me. That one was about $286. But I forgot which one I got him. I think I got him the HMO. No, he got the PPO one. But again, that was a long time ago. But I've seen them and I've spoken to them before this year. You took them almost 400 something dollars, $435 for even for a fee. And they got these third parties that you talk to. You don't even get to talk to the Aetna or the Cigna. You're talking to the third parties first to tell you about the Obamacare and how much you're going to pay. Almost 400 and something dollars. He drives a truck, so he had to get it. I mean, a lot of people do that though. A lot of people drive truck, they work for companies that don't have insurances, and to me, I would definitely rather them have insurance than not have insurance at all. So again, it's not just people who are home that have Medicaid. Working people have Medicaid too. It's like a cutoff for Medicaid. I know if somebody comes to the hospital and they don't have insurance, we have the financial counselors to tell them, let's see if you can qualify for Medicaid, even though the person works. Let's say the person works at Burger King or something and they don't make adequate money to get insurance, but they are making less money to get Medicaid. So that's why I was kind of confused on how the whole situation is going to go down with the Medicaid new bill. But again, if you're going to get Obamacare is not cheap. Okay. Now I don't know what the president with the Obamacare, but I think Obamacare is good, especially for people who do not have insurances and people who have their own business that want to get insurance. I think the Obamacare is okay, but again, you're talking about almost $400 a month. Obamacare is not cheap. I just finished telling somebody that the other day when I had to get it for my friend who drives the truck. He couldn't believe it, but he drives a truck. He make money. Of course, he paid it. They want that $400 right up front. Of course, he paid it. But again, if you on Medicaid and you say forget it, you don't need the Medicaid, it's not worth it to not do the little work study. if they're gonna have you do work study. If they're gonna have you do, it's either gonna be at the projects, it's gonna be the housekeeping, it ain't gonna be no regular job. They're gonna have you doing something for 2 or 3 hours a day. If you're gonna do that, you might as well just work. Forget it. You might as well just work and then get the insurance from the job. Because if you say, "Oh, I don't want it," and then you want to do Obamacare, you talking about $400. I'm telling you, somebody just asked me that, and we just did like a rundown. I called them to see what they was going to say, and I called them to see what they was going to say. I couldn't believe it. I couldn't believe it. They said $457, 337 plus an extra $100. And it can't be active on that day. Now when you go to work, the first day you go to work, your insurance is active that day. It's either Obamacare is active on the first and on the 15th. No exceptions. No exceptions. If you pay on the 15th, you pay on the 15th again, or whatever, something like that. But again, watch your policy, pay attention. I don't know to what extent it's going to be. I don't know to what extent they're going to carry it to, but they start messing with your insurance and your child has allergies or asthma and you got to take them. Know your next steps. Know your next steps. It's got to be something else besides Obamacare. And this is for like my single mothers. This is for people who are at home. This is for people who have not been working, that are homebound, and you have children. You have to stay home and take care of them. Ask your social worker, what else can you do if you cannot do that work study? The work study is like 3 hours or 4 hours or something like that, because you still have to have daycare. You still have to have somebody watch your child. So, I would try to get into some type of program, get yourself ready to go to work. Ask if they can give you some type of stipend or some type of voucher. But again, they're cutting out so much stuff. I don't think they're giving anybody anything. I don't know which way that go. I don't think they're giving anybody anything. But, just be curious about that Obamacare. Okay. You don't have Medicaid, your Medicaid is going away. You working and you're getting Obamacare. You still have to pay that Obamacare. Okay, you still have to pay that Obamacare, and you're gonna have a higher deductible, and you're gonna have a higher copayment. But they're gonna pay your bills. I mean, I just see the logic of it. I mean, to me, it's just like having regular insurance. And because if you're working and your employer is paying 50-50, you paying like $50 every 2 weeks, and then they paying the other 50 every 2 weeks, only $200, and their Obamacare is three and change. You paying double. So, I think it's sad because there's no contract. I'm not saying that Obamacare is not good. I mean, I don't do the research on it, but I haven't encountered patients who had a problem with it, but I know it costs money. All right, so we're only 13 minutes in. This was just a quickie, 10 minutes, but watch that Obamacare. I'm telling you right now, it is not cheap. It's not.